Because heart disease can develop gradually, the first symptoms are often overlooked. Staying aware of new or unusual symptoms becomes increasingly important. After age 75, while many changes are a normal part of aging, others may signal that your heart needs medical attention. Not every symptom means you have heart disease, but recognizing persistent or worsening changes can help you and your healthcare provider decide whether further evaluation is needed. Today we'll look at 15 symptoms that should never be ignored after age 75.1. Irregular heartbeat or racing. Fluttering or skipping heartbeat that occurs repeatedly should be discussed with your healthcare provider. Point 2. Chest discomfort during activity. Discomfort that appears while walking or exercising and improves with rest should always be evaluated. Point 3. Shortness of breath. If everyday activities such as walking to the mailbox or climbing a few stairs suddenly leave you breathless, it's important to mention this change to your healthcare provider. Point 4. Persistent fatigue. Feeling unusually tired every day, even after getting enough sleep, may be more than simple aging when the heart cannot pump blood as efficiently as it should. Your muscles and organs may receive less oxygen, making routine activities feel much more exhausting than they once did. If this change continues or becomes worse, it deserves medical attention. Point 5. Swollen feet or ankles. Swelling in the feet, ankles or lower legs is often overlooked because many older adults assume it's caused by standing too long. However, persistent swelling may sometimes be related to fluid retention associated with heart conditions, although it can also result from kidney, liver, or vein problems. A healthcare provider can help determine the cause. Point 6. Dizziness or feeling lightheaded. Occasional dizziness may happen for many reasons, including dehydration or certain medications. But if you frequently feel lightheaded, unsteady, or close to fainting, especially during activity, it could indicate that your heart is not supplying enough blood to your brain because dizziness has many possible causes. It's important to have recurring episodes evaluated. Point 7. Difficulty sleeping flat. If you find yourself needing extra pillows to breathe comfortably, or waking up at night feeling short of breath, don't assume it's simply part of getting older. In some cases, these symptoms may occur when fluid builds up in the lungs due to heart problems. Keeping track of when these symptoms occur can provide helpful information for your healthcare provider. Point 8. Reduced exercise tolerance. One of the most common but overlooked changes after age 75 is a gradual decline in physical endurance. If you once enjoyed gardening, shopping, or taking daily walks but now become exhausted after only a few minutes, your heart may be working harder than before. While reduced stamina can have many causes, including lung disease or muscle loss, a noticeable decline should never be ignored. A medical evaluation can help identify the underlying reason. Point 9. Sudden changes in daily energy. Many older adults blame low energy on getting older, but a significant drop in energy levels may sometimes indicate that the heart is struggling to deliver enough oxygen, rich blood throughout the body. You may notice that preparing meals, making the bed, or even taking a shower feels much more difficult than it did a few months ago. These gradual changes are easy to overlook because they often happen, rather than accepting them as normal aging. It's wise to discuss persistent fatigue with your healthcare provider, especially if it occurs alongside other symptoms like breathlessness or swelling. Point 10. Persistent cough. A cough that lasts for several weeks isn't always related to a cold or allergies. In some cases, especially if the cough becomes worse when lying down or is accompanied by shortness of breath, it may be associated with fluid buildup linked to heart failure. This doesn't mean every chronic cough is caused by the heart, but it's one reason why persistent coughing deserves proper medical evaluation instead of self-diagnosis. Point 11. Rapid weight gain. Stepping on the scale every few days may reveal changes that are easy to miss. In the mirror, a sudden gain of several pounds over a short period may result from fluid retention rather than increased body fat. This type of weight gain can sometimes occur when the heart is unable to pump efficiently, allowing fluid to build up in the body. If rapid weight gain happens together with swelling or breathing problems, contact your healthcare provider promptly for guidance. Point 12. Confusion or difficulty. Concentrating the brain depends on a steady supply of oxygen-rich blood to function properly. If blood flow becomes reduced, some older adults may experience confusion, forgetfulness, or difficulty concentrating. These symptoms have many possible causes, including infections, medication side effects, or dehydration, so they should never be ignored. Sudden confusion, especially when accompanied by other concerning symptoms, requires prompt medical attention. Point 13. Cold hands and feet persistently. Cold hands or feet may simply reflect cooler temperatures, but they can also indicate reduced circulation. If your hands and feet remain cold even in a warm room, or are accompanied by numbness, fatigue, or leg discomfort while walking, it's worth discussing with your healthcare provider. Good circulation is essential for delivering oxygen and nutrients throughout the body, and changes in circulation deserve proper evaluation. Point 14. Frequent nighttime urination. Many older adults wake up during the night to use the bathroom, but a noticeable increase in nighttime urination, especially when combined with swelling in the legs or shortness of breath, may occasionally be associated with changes in heart function. Because several medical conditions can cause this symptom, it's important to mention any new pattern to your healthcare provider. Point 15. Don't ignore persistent changes. Perhaps the most important message is that your body often provides small clues before a serious medical emergency occurs. While none of these symptoms automatically means you have heart disease, ignoring them could delay diagnosis and treatment. If an underlying condition is present, pay attention to new, persistent, or worsening symptoms, even if they seem minor. Keep regular medical appointments, take prescribed medications as directed, and speak with your healthcare provider whenever you notice meaningful changes in your health. Early evaluation often provides more treatment options and can help maintain your independence, mobility, and quality of life as you continue to age. Point 16. Pain in the neck, jaw, shoulder, or arm. Many people associate heart problems only with chest pain, but that isn't always the case, especially in older adults. Sometimes discomfort begins in the neck, jaw, shoulders, or one or both arms. Without causing severe chest pain, the sensation may feel like pressure, aching, heaviness, or discomfort rather than sharp pain, and it may appear during physical activity or emotional stress before improving with rest. While these symptoms can also result from arthritis, muscle strain, or other conditions, they should never be dismissed if they are new, recurring, or accompanied by shortness of breath, unusual fatigue, dizziness, or nausea. Recognizing these less obvious warning signs and discussing them promptly with your healthcare provider may help identify potential heart conditions before they become more serious.